What's going on, guys? It's Dr. Rob with your 2-minute tip this week. Today we want to show you a couple exercises that not everybody should be doing. And no, it's not the deadlift. Everybody's afraid of the deadlift because they think they're going to hurt themselves. Deadlift, one of the best exercises you can possibly do when done properly. The exercises I'm going to show you today are very common shoulder exercises that put the shoulder in a compromised position, which means that if you don't have perfect shoulder and shoulder blade control, you're more likely to injure yourself. So the first exercise is the shoulder shrug, where a lot of people like to kind of go up through this. This is more common in guys or bodybuilders because they're trying to work their upper traps and get strong in through there. Now what happens is the upper traps already tend to overwork and you're gonna make them even more dominant or create more of an imbalance. When the upper traps overwork, they become very tight and you're gonna get more shoulder pain because you've created this imbalance and your shoulders are walking around like this. The next exercise is what's called the upright row. So it's often when people are pulling up and lifting up like this. What you're gonna notice is when I'm doing this, my shoulder is in this rolled forward position, and that's actually a very compromised, unstable position for the shoulder. So if you have any shoulders issues at all, this is actually gonna highlight those, and you often get kind of like a pinching or a sharper pain at the front of the shoulder, which can lead to rotator cuff issues. So be very, very careful with this. You really wanna make sure you're stretching, being gentle with this one. If you are doing it, we recommend avoiding it for most people unless you have very specific goals. Now the next exercise you should be avoiding, especially if you have shoulder issues, is the tricep dip. Most of the time you see people doing this on bars or on rings or even against a bench. What you'll notice with the tricep dip, your shoulders pull back, and this again puts it in a very compromised position and puts a lot of stress and strain on the rotator cuffs. I always remember Mike Boyle, who's the strength and conditioning coach for the Boston Red Sox, never let his athletes do tricep dips because of the wear and tear and the high risk for injury on these shoulders. So if you have shoulder issues, tricep dips should not be in your repertoire. Look for another tricep or chest exercise that you can combine to do it safely. So the last exercise is actually just a simple shoulder press when you're pressing overhead. Now, by itself, this exercise is actually not bad for you, but what it can do is highlight some imbalances. If you already have an over-dominant trap that we talked about and underactive lower traps, what's gonna happen is it can possibly cause tension and even flare-ups of headaches. So if you're getting headaches after working out, this is probably one of the more common causes, is that shoulder press through there. Now, if you are gonna do shoulder presses, we highly recommend you do use a dumbbell, so you're doing them in a separate plane. A lot of the time people use a barbell, and that locks you into a very specific range of motion and can put extra stress and strain on the shoulder. So when you are doing the shoulder press, if you choose, you don't have to go all the way out wide. What you do is bring it in 45 degrees. This is actually the strongest position for your shoulder, and now you can do that same shoulder press movement in the safest position, okay? Now these exercises are not inherently bad, they just tend to put extra stress and strain on shoulders that could possibly lead to injuries down the road. Now, so be careful with this, make sure you're doing your mobility work so you have a beautifully moving shoulder so you can get away with these more demanding positions for the shoulder. If you want help getting your shoulders moving or rehabbing old shoulder injuries, reach out. Our physiotherapists are absolutely amazing. We can give you the specific exercise for your specific issue so you can do any exercise you possibly want, okay? Have a good weekend.